Thank you, Philip. So it's my honor today to share with you about this guidance, which is drafted early this month by the ISDE. So basically, the aim of the guidance is to provide healthcare professionals within the esophageal community a general guidance on managing our patients during this COVID outbreak. The evidence related to this pandemic actually is still emerging and evolving. So we are now trying to gather the information as much as we can for this guidance, but of course, the things are changing so that the guidance could be reviewed and changed accordingly. And we also acknowledge that there are differences among the regions in terms of the severity of the outbreak, supply of medical resources such as PPE, surgical masks, and respirators, occupancies of hospital general beds and ICU beds. So I believe the purpose of this webinar is actually to discuss the guidance notes with reference to all the experts that are here from different parts of the world. So the guidance notes actually consist of a total of 14 statements. So the first two are related to the general preparation of the hospitals and their healthcare professionals in order to adapt to this current COVID-19 outbreak. And the subsequent six statements would be related to endoscopic procedures, including how we can prioritize our procedures and our service, how we screen patients according to the risk of COVID-19 infection, and the usage of protective gear during the endoscopy and in different endoscopic settings. So in the subsequent four statements are more related to surgical parts. So we are also talking about how we prioritize our surgical procedures and precautions to be taken in the preparation of upper GI related surgical procedures. And we have a final two statements with special notes about esophageal or upper GI cancers and how we suggest to reduce the risk of our healthcare professional as well as our patients who are suffering from upper GI cancers of COVID infection while we try to maintain quality treatments for their cancers. So I think we'll start the ball rolling from Kasari about the endoscopic parts, right?
Yes. Okay. Thank you, Hongqi. So